If you are a man over 60 and notice that your morning wood has slowly disappeared, your body is sending you a critical vascular signal. Most men assume that losing this natural morning reflex is just a normal, inevitable sign of getting older, but clinically, this is a dangerous misconception. The absence of morning wood is actually one of the earliest indicators of silent arterial blockage. There is a simple biological rule. Because the arteries supplying your pelvic floor are 3 times smaller than the coronary arteries of your heart, a vascular blockage will always restrict pelvic blood flow years before it triggers a heart attack. If your morning stiffness has gone silent, your blood vessels are actively telling you that your cardiovascular system is under stress. I am Dr. David Chen. Today, we will explain exactly what morning wood is, why its loss triggers a permanent damage process, and a simple 3-step daily routine to restore your pelvic blood flow naturally. To understand why this happens, we must look at how your body maintains its vascular health during sleep. Every night, during the deep stages of REM sleep, your brain drops sympathetic stress and floods your pelvic tissues with rich, oxygen-rich blood. This reflex occurs 3 to 5 times a night, keeping the tissues oxygenated for up to 3 hours. However, if you lose this natural reflex due to restricted blood flow, your pelvic tissues undergo chronic oxygen starvation, known as hypoxia. Over time, this oxygen deprivation triggers cavernous fibrosis. This is a process where the flexible, smooth muscle cells in your chambers are permanently replaced by rigid, dead scar tissue. Once this scar tissue builds up, it damages the mechanical valves that lock blood inside, leading to a permanent venous leak. To halt this process and recover your natural circulation, there are 3 simple habits you can start tonight. First, adjust your sleeping posture. Sleeping flat on your back compresses Alcock's Canal, which is the narrow passageway holding the pudendal artery and nerve. This blocks night circulation. Instead, sleep on your side with a thick pillow placed between your knees. This immediately opens up the pelvic basin, decompressing the arterial path. Second, eliminate high insulin spikes before bed. Eating heavy carbohydrates or sugars within 3 hours of sleeping spikes insulin, which directly suppresses the nocturnal release of growth hormones and nitric oxide. Keep your evening meals light and protein-focused to allow your blood vessels to dilate naturally during sleep cycles. Third, practice the pelvic tilting release for 5 minutes before bed. Lie down with your knees bent, gently flatten your lower back against the floor, and tilt your pelvis upward while exhaling deeply. This decompresses the pelvic floor muscles, releasing the tension surrounding your internal pudendal arteries. However, we must be clinically honest. While posture adjustment, lowering insulin, and daily stretching are excellent habits for relieving muscle pressure, they are slow. Reversing years of vascular decay and restoring damaged arterial linings through stretching alone can take 6 months of daily consistency. During this long window, the nightly oxygen starvation continues to scar your tissues. To speed up recovery, a targeted vascular accelerator is often required. This is why I recommend the clinical botanical protocol of AlphaFuel Pro. This is not a temporary chemical drug that forces a stressful reaction while raising your blood pressure. It is a natural formula designed to repair the vascular endothelium. Using wild-harvested botanicals like Urtica dioica and Tonkat Ali, AlphaFuel Pro binds to SHBG to release active free testosterone, which is essential for pelvic nerve repair. Clinical data shows these active extracts help relax the smooth muscles of the pelvic floor, allowing blood to enter and lock inside, reversing the venous leak naturally. I have placed the official clinical study and presentation link to this natural formula in the first pinned comment below this video. If you want to review the research for yourself, feel free to examine it. Thank you for watching. Stay proactive, and I will see you in our next consultation.